My name is Tamer Theodossy. I'm a consultant oral surgeon. I work at different BMI hospitals, including BMI, the London Independent, and BMI Hendon. I think the most common patients that I see in practice are ones coming in with problems with wisdom teeth. Wisdom teeth are usually the last teeth that will come through in the mouth, and as such, sometimes there's not enough space for the teeth to come through the jaw, so they end up being impacted. And patients come in presenting with varying degrees of symptoms, from just pain because the teeth are coming through, or a bit of swelling, a bit of inflammation of the gum, some food trapping around them, or in severe cases, maybe even infections and limitations in mouth opening. So we end up seeing those patients clinically to assess kind of the position of that tooth, the degree of impaction. Is it kind of aiming up normally, or is it aiming towards the tooth in front, or just aiming behind? The problem that we have with those is that they continue coming through, usually between the ages of 18 and 25. Saying that, we still see patients who are slightly of the older group who will present because that tooth has caused damage to the tooth in front of it, and we have to address those wisdom teeth for them to allow the dentist to save that other tooth for them as much as they can. So once we see them clinically, we tend to kind of send them for some x-rays, whether it's a plain x-ray or a more complex 3D image, to allow us a good idea exactly about where the roots are in relation to the nerve that's of importance to us, that runs very close to the roots of the wisdom teeth. If we decide on surgery, then we give them all the options available to them, be it just local anesthetic, where we just numb up the gum around the tooth and take it out, or we offer them sedation if they're a bit anxious, or even general anesthetic, which is something we can only provide in the hospital setup. Recovery varies from patient to patient, but we usually advise them about some painkillers for the next few days to make sure we get rid of any discomfort they have from the surgical procedure. We give them advice about how to control the swelling after the procedure. Most patients should be okay within 24 to 48 hours to resume normal life activities and go back to work and go back to the gym and do what they need to do. So if you experience any of those symptoms, then it's definitely worth you kind of making a phone call and booking an appointment to come and see a consultant, so you can have those issues discussed and dealt with sooner rather than later before they become more problematic.